Thank you very much for the introduction. Yeah. So I'm here to present Smart Bear. Smart Bear basically is a project about home care and assisted living for the elderly, so people above 65 years old. I will talk specifically more about the approach that we followed in Madeira, in Portugal. So the main objective, like I said, is to develop a platform, something like support the elderly to have a more independent living at their houses with more quality of life as well. We started by looking at a couple of target conditions, so comorbidities, that are mostly prevalent in the population. So, for example, cardiovascular diseases, which is the first cause of death worldwide, hearing loss, mood disorders, cognitive disorders, balance disorders, frailty. We also included here low back pain due to a collaboration that we had since the beginning of the project with another program from the European Commission, which was the Smart for Health project. So looking at all these incidences, so our idea is that we could recruit a number of people from different places in Europe and provide them with the tools so that they could really monitor and self-monitor their lifestyle and live with more quality a long time. So yeah, so the clinical goals are basically twofold. So the one I said already, improve quality of life, and the second one also reduce multimorbidity. So through a more active monitoring of vital behavioral and environmental parameters, and also better integrated care. The project is quite large, so it was a 20 million euro project overall. Involved 20 plus organizations and had 5 pilot sites that recruited more or less 5,000 people in total. There have been more than 20,000 devices distributed throughout the population, so including smartphones, blood pressure monitors, smart scales, and so on. And so basically you can see a little bit the magnitude of the whole thing. So our approach is actually, like you understood already from the previous numbers, is based on mobile health. So we identified a number of devices that are off the shelf, so everybody could buy them in their daily activities. And we actually provided these devices to our patients. So identifying more or less what would make sense for their conditions that they would have, and provided these devices free of use for them. So all participants received a smartphone, a smartwatch, a thermometer, and a smart oximeter as well. So this is common for all participants. Then the patients with cardiovascular disease would receive, in addition to that, the smart scale and the blood pressure monitor. The patients with some mild cognitive impairment would receive some home sensors as well, so that they could monitor, for example, light comfort levels and humidity levels, things like that. Patients with hearing loss, they would be given some hearing aids. Patients with balance disorders would be provided the technology that you have seen already in the Telerehab project. So in this case, it was the version of HoloBalance. And patients with low back pain would receive posture wearables. So the idea is that giving all these devices to the people that we recruited in the project, we would be able to collect data to a platform and draw some AI-based analytics based on this platform, so that we could really provide some recommendations depending again on the conditions that people have. So for example, in the case that they have some balance disorders, we would recommend them some therapy programs. In the cases they would have some low back pain issues, we could also recommend them some physiotherapy programs, and collect data through all the time that they would be involved in the project. So we developed an app, so a quite simple one for, let's keep in mind that we are talking about the elderly. So you can see here an app with big buttons and screens and big numbers. Basically, all the participants have this app. They would get the values from the devices they are using through the usage of this app. So they will see immediately all the values that they are being measured, that they are measuring, the history of the values throughout time, and they would know that in the background all of these values would be going to the Smart Bear platform, which is accessible by the clinicians that we have in the project. So they would feel already more accompanied there. So not only seeing the value, but also knowing that their doctor would have access to these values. Inside the SmartWare app, we had some sub-apps. So for example, we have some diet apps, so to recommend some routines of eating better and exercising more and things like that. And we have, of course, some alerts. For example, if we see that there are some unusual values, the idea would be that the patient would receive an alert and would be advised to consult with their doctor. In Madeira, so for you that don't know Madeira, Madeira is a small island in the Atlantic Ocean. So it's quite an ideal ecosystem to test this kind of project because the community is not so big. What we decided to do, in addition to what was already expected by the project, so giving the devices, we implemented this stand that you see here in the figure to work as a help desk and an exhibition stand also for the community. So they could go there, they could see how things work. If they have problems while in the project, we would help them and so on. And it was a success story here on these things. So we implemented the stand in the center of Funchal, so quite accessible to everybody. And actually, it allowed us to recruit more easily because people would be informed of what they would get inside the project. And also we noticed that throughout the time there is a sense of community being built also within the participants of the Smart Bear project. So some facts and figures by now. So the project is ending next February, so next month, after 5.5 years, more or less. So in Portugal we recruited 501 participants. We collected more than 6 million observations, so readings from blood pressures, activities, and so on. We delivered almost 3,000 devices to our population, so we had quite a lot of contacts with the help desk, so 6,580. So you can see here the progress regarding the patient enrollment over time. So basically what happened, we started as our objective was only to have 100 patients. So you see here stabilizing in 100 patients. And then we are actually invited to progress and enlarge our study to 500. And so this you can see this evolution throughout the year of 2024, so the past year. In Portugal, the majority of incidences were on cardiovascular, so most of our participants have cardiovascular disease. We have more females than males, and in terms of age distribution, you can see here that the majority of them is between 65 and 70. So basically, this is the majority. In terms of devices, you can see also here the progress. So you can see that most of them have been distributed quite more in the past year, so which was where we had the big boost of devices. So, but what now? So we had some questions here in the room regarding my previous colleagues about sustainability. So what now? We verified that this is actually something good for the community. So there is the sense of empowerment by people. They also are learning about digital health. So it's something that they were not really aware about. Clinicians involved also recognize the importance of the initiative. And the participants have expressed the desire that this would keep alive, so that their own general practitioners would have access to the data being collected. Sorry about this. to the data being collected, and not only the clinicians involved in the project. So considering all that, what we decided to do in the last months of the project was actually to implement a connection with the regional health system of Madeira, so which is called CESARAM. And so basically what we are currently implementing, so it's still work in progress to finish next month, is to facilitate an automatic data transfer from all the participants that have been involved in Smart Bear to CESARAM, so that we can facilitate, for example, a scenario such as the one that we have here in the slide, where we have, for example, a patient visiting a certain doctor in Madeira, and he can tell him, okay, I'm part of Smart Bear, I would like you to see if my data is fine, is well or not. And so basically what the doctor has to do is basically just to click and ask for permission for the data of this patient within Atrium, which is the CESARAM's software, and you would be able to see all the data that was collected regarding this specific patient in Smart Bear. So this is something that is, like I said, being done. So we are getting from Smart Bear data on blood pressure, heart rate, weights, steps, oxygen saturation, audiograms, tympanograms, all of these things, depending on the conditions of the patient. We would have all of these things. Also a number of questionnaires like MOCA questionnaires and things like that were elaborated during the project. So all the security component is already in place, so we have the connection, and we are just now working on the visualization of the data inside CESARAM. So ideally we would be seeing some things like that. So for example, having access to graphs with vital signs or steps and so on. After having that connected, and this is my final slide, there is already a functionality implemented in CESARAM that also completes the loop. So basically, you can see on the left, this is the app from CESARAM. The patient has this app. He can go to the app and ask to be part of the Smart for Health functionality. So like I said, Smart for Health was a previous project. It's available there. So he can go there, ask to be part of Smart for Health, and basically what happens here is asking for control of the data. So what does this mean? This means the patient can tell CESARAM, give me the data, my data, and in this case he would get, on the right side, you will see the Smart for Health app on the right side. He would be able then to get all the data that was in Smart Bear, but also the data that is also in the EHR as well. So medications, examinations, and so on. So you will see that. So with this, I think we ensure sustainability, at least of the data that was collected during this project. If it is proven to have real value in terms of reduction of visits to the doctors and so on, I'm quite sure that the program will continue with local funding or with regional funding and so on. So like I said, so Smart Bear is there. It proves the point. Now we also have the data from Smart Bear within CESARAM, and if we have it in CESARAM, then patients could use this functionality to actually own and request their own data, including the one from Smart Bear. And thank you very much for your attention. I don't know if I was on my time.
Thank you, Carlos.